Good afternoon, everyone, and welcome to Metropolis's Think Tank Thursdays. My name is Tina Brennan. I'm the Vice President of Marketing at Metropolis. This is the 6th year for Metropolis's Think Tank series. It's a thought leadership program that visits top firms in key markets in North America. Today, we are very pleased to be hosted by EYP, who will be exploring how leading health organizations are ensuring the safety and engagement of their workforce and what other sectors can learn from their experience. Hosting an event like this requires the support of great firms like EYP, as well as our amazing sponsors. We'd like to thank AVA, Create, Innovate, Sustain, DuPont Tedler, PVF Film for every surface worth protecting, etc. offers the right mix of attitude, style, and products to make your work style meet your lifestyle. Loftwall, as manufacturers of colorful, flexible privacy, they bring focused spaces to life through data-driven design. Material Bank, the largest material marketplace for sampling in the architecture and interior design industry. And Versteel, a solutions provider of American-made furnishings for working and learning environments. And now I would like to introduce today's moderator, our editor-in-chief at Metropolis, Avi Rajagopal. Avi, take it away.
Thank you, Tina, and welcome everyone to another Metropolis Think Tank Thursday, and thank you so much for joining us today. We're here to talk about healthcare workplaces. All of us have had to adjust, of course, during this global pandemic, and there is not a work organization in the world that the pandemic has not touched in some way or the other. Yet, healthcare workplaces in particular have been sort of, canaries in the coal mine. They've been right at the heart of this public health crisis. And of course, they have had to deal with, real challenges in terms of their services, in terms of the demands on their employees, all the while also accommodating the health and safety of those employees. It has been a tough tightrope to walk, I'm sure. And there are important lessons there to learn for all kinds of workplaces. So to talk to us more about how healthcare organizations have been, coping during this time and what other kinds of workplaces can learn from that experience, we have with us today Linda Gable, who is a Senior Interior Design Planner at the Ohio State University Wexner Medical Center. Linda, thank you so much for joining us today. We also have Jennifer Manier, who is the Associate Director of Workplace Transformation at Memorial Sloan Kettering. Jennifer, it's a pleasure to have you on today. And Roseanne Pisklak, who is the Principal and Lead Interior Designer at EYP, who of course is hosting today's conversation with us. Thank you so much, Roseanne, for joining us today. I'd like to kick off with Jennifer. So Jennifer, before you joined Memorial Sloan Kettering, you were a senior strategist with design firms, and I'm sure you worked with a whole range of clients, not just healthcare clients. How do the workplace challenges at Memorial Sloan Kettering compare to those of other organizations? Are there some unique concerns and opportunities for workplace within a healthcare organization?
Hi, Abby. So thanks for having me today. I indeed have worked with organizations in many other fields and actually mostly not in healthcare. So, it's been a really interesting ride for me to arrive in healthcare at the height of the most exciting time, right? I would say similar things that we are seeing, that we want to achieve here at MSK that we're seeing in other organizations are things like, how can we best support our people to perform, innovation, attraction and retention of talent. Those are all things we hear across industries. Digital transformation is also a big topic for us. Luckily, we had really started that process pre-COVID. So when COVID hit, we were lucky that we were able to transition very rapidly into, telehealth models of care, having part of our staff remote. And then obviously diversity and inclusion is also something that is very important to us. So these, I would say, are the things that are kind of in common. Some unique things that, I've noticed is that healthcare in general tends to be a little bit more traditional in terms of the workplace than other industries like tech or things like that. We're still seeing a lot of enclosed offices on the perimeter, things like that. So, the kind of like journey that has to be traveled from that point to models where there's much more freedom and choice in terms of where people might go to work is quite, a challenge. And we also have to really consider that while in many industries, we're talking a lot about personal choice and how, remote work that's happened during COVID opens up possibilities of providing more personal choice to employees with regards to where they want to work. In our world, that's not always the case, right? Not everyone gets to pick where they're going to work. Some of the work really has to be done on site. And so really what's interesting, I think, for people in roles similar to mine is to really start thinking and encouraging our leadership to think about what are other ways that we can give autonomy to our people, because this idea of personal choice is not just, a fad. It really is, because we know that giving people more autonomy supports their performance. And so that's something we want to, provide to our people, even when they cannot choose that particular piece of their work experience. Another thing, that came to mind recently to me was that one place where healthcare, I would say, is at an advantage compared to other industries is that empathy is absolutely part of the DNA of any healthcare organization, right? That's what we are all about. And in moments of crisis like this, or in moments of heightened change, which, truly, I believe that there's no, new normal, or forget about normal in my book, it's like, it's going to continue to change. Transformation is just continuing to accelerate. I think the notion of like normalcy, I think normal is just going to be continuous change, frankly. And so in that context, I think having a culture that is already infused with that notion of empathy is really an advantage, frankly, that we have seen come to life during this crisis. Everyone has chipped in. We had some of our employees that were not in, that were in back office functions were redeployed to go, for example, we had a lounge set up in the courtyard of a school for our clinical staff to go take breaks. Some of our corporate staff were actually there to give them snacks and stuff like that. So this kind of spirit, is really great, and I think is something that we can really leverage moving forward as this new way of working that might continue. Past this period. Remote work, distributed teams, sometimes leads to breakdown of sense of belonging and things like that, and sense of team. And so I think this empathy that's part of our culture is going to be really important and instrumental in making this successful for the long term.
Thank you so much, Jennifer. That's a really great overview. I think what's really interesting to me is, even though I agree with you, as you said, that, in the healthcare workplaces, some people don't have the choice, some people, and at the same time, healthcare workplaces are quite uniquely, empathetic organizations. Yet I think there's lessons in there for all kinds of workplaces. In almost any workplace, some people have more choice than others. And sometimes it's about who we consider as part of the workforce and not, right? So, maintenance staff very often in any office, don't really have huge choice in terms of whether they show up to the office or not, right? And so, there are, even though it may not be as extreme as it is in healthcare workplaces, there's so much in what you say that I think is translatable and relatable, from any kind of workplace experience. So thank you so much. And the point on empathy is well taken. I saw all the panelists nod to that. I'm sure many audience members were nodding as well. It's just really important. If there is a difference in terms of level of choice or level of access among different parts of an organization, it really behooves people in the organization to be empathetic to each other, to understand that not everybody might have the freedoms that you do, not everybody might have the choices that you do. And so, when designers talk about designing for choice, and I'm going to come to Linda in just a second, that the word choice can be very different for different people. Linda, so we heard from Jennifer what Memorial Sloan Kettering's experience has been. Tell us a little bit about what effect the pandemic has had at the Wexner Medical Center, and how you are responding to that, both as an organization and, of course, you as somebody who is really responsible for those facilities and for planning for those facilities.
Thanks, Avi. I tell you, it's we're like a big family, and if you know Ohio State, we're all Buckeyes, right? Even the medical center. So there was immediately a sense of we're all in this together. High School Musical song. Okay, rings in your ears, right? But it's absolutely true, because we had to focus on trust with each other between, because we support the university, College of Medicine, as well as, our full medical center platform and ambulatory, regional facilities. And as an academic medical center, we really have to show the community effort. So, initially it was safety first, right? So if you're in not essential clinical, you worked from home. And so how do you, it was an immediate trust that had to be reinforced with management and staff. How do you enable people to work from home safely? And, and really it was an eye opener between, I would say 80% of our non-clinical staff work from home right now. And then we're trickling back in with research and lab folks. And of course, our academic medical center teaching platform is back up and running within 6 weeks. And honestly, it never really stopped. So how do you teach safely? So our department's in the middle of all that. So, it was all hands on deck. We had to immediately stop all of our construction projects. And there was about 460 construction projects that just went on pause so that we could focus on the immediate response. So all hands on deck with social distancing diagrams for teaching in classrooms and workspace, for immediate caregivers, turning conference rooms into hoteling, to getting all those plastic barriers up. So it was really logistics and supply chain, how to source everything. It was a true community effort. And I don't think we had ever done that before, to respond to such a crisis where everyone was working together immediately. Usually it was very, you're hierarchical and transactional in some instances, but this was immediate ideas, response, decision, move forward. And it's changed how we do work. We're a nimble team, where before we were like a barge. It's a big, big place. Everybody's used to doing the same thing, and we had to learn to think and work differently. So I think that was the biggest cultural change that we experienced, for sure, across all the platforms. And what's most challenging for us is the COVID fatigue. And people do miss that sense of community if they're working remotely. And others like the sense of independence, of being able to balance. If they have kids in school and they have to work full time, how do you balance that? And their spouse might be working. How do you balance all that? Because there's no childcare. So how do you, frontline caregivers, their children were being taken care of by medical students. So literally, we were trying to help each other out, solve problems, to keep the primary caregivers going. We have a hotel on campus. Those rooms were turned over to primary caregivers to be able to rest safely from their family. So it's just been an amazing think tank, so not to be a pun on what we're talking about today, but it was really a think tank approach, and it's really changed how we do things. Telemedicine is going to be here to stay. We went from maybe 80 calls a month to 800 a month, and it's escalated from there. We have, I think, now over 1 million telehealth visits since March, and that's just phenomenal. So it's kind of changed that as well, and patients love it. They don't have to travel. So anyways, there's a lot to cover, but I think I'll stop there and let you ask some more questions. So
I love how in every challenge that you just mentioned, there's a positive hidden in there, even with that last piece about telehealth, right? And I think that's been, just hearing you talk, right? While this has been an incredibly challenging time, whether it's for, I think healthcare organizations have felt this particularly just because, they've had less choice than, some of us have had, that, they've had to rise to the challenge. And in doing so, they've discovered a new resourcefulness, and they've discovered that there are new resources that they can rely on. And, I think in general, that also behooves, all of us to think about, as we cope with this pandemic, what resources can we rely on in our organizations that maybe we're not thinking about? It's really, what you're talking about, this kind of cultural change, that's so hard to bring about in normal times, right? But when there's a challenge, we all really rise to it. Roseanne, I'd love to hear from you a little bit about the implications for design practice. But before we do that, just a quick reminder to all of you who are listening in today. I see we have one question in. We are open to questions at any point in time during the discussion. Please use the Q&A button, get your questions in. Let's make this a discussion. We are here to respond to any ideas, any comments, any suggestions, any questions that you might have. So please get those coming in. We'll be ready to take those in just a few minutes. Roseanne, let's bring you in on this. What are you, as a design practitioner, as an interior designer, what are you learning from the experiences of your healthcare clients? Are you seeing any general approaches that might transfer over to other kinds of workplaces?
Certainly. Well, the one thing I do want to start with is really set the scale. We've talked about how, healthcare workplace is really large. I mean, healthcare as an employer occupies over 18 million employees across the US, and when we start to think about that scale and how all those employees really had to pivot at a moment's notice to really deal with the pandemic and keep those workforces moving forward, it's just incredible to me. And to hear the stories as well from Linda and Jennifer. But I want everyone to really understand that when we talk about healthcare workplace, we're really talking, there's multiple avenues. I mean, it's everything from patient care to healthcare administration, to education, to research, to support, as you mentioned, environmental services, to even complementary partnerships. So we really have to understand that vast landscape of interdependencies and interconnectivity, because they all really truly flow together to support patient care. So when we start thinking about workplace really is everywhere, and now it's even from home. So in terms of what we're learning, one of the key things that happened this summer is that EYP created a healthcare workplace consortium, which we had I first met Linda and Jennifer both on this panel. We had over 15 facilities and planning personnel come together, and it was really to connect some people who really needed to talk about and share their experiences of what their facilities were, what the challenges were, and how they were, overcoming those challenges. I mean, first and foremost, everyone's concern was really for the patient, the concern of their staff, the patients and of course the communities. But at the same time, everyone was really challenged with, how do you financially and fiscally, be responsible? How do you respond to this great unknown? So what I really found interesting is that, these large institutions were, number one, able to, shift and work from home so quickly to de-densify their campuses, not only for patient care, but also to really protect their employees. But what I didn't expect was how quickly the attitudes toward remote working changed. Because as Linda had mentioned, it takes some time in the medical world because you have to generate evidence, you have to support these decisions. But the work from home was proven so quickly. And I think that's the right direction and it's here to stay. So in thinking about how, healthcare can influence other markets, I want to be very clear that we have to be very careful about, that form follows function and needs, and not necessarily form follows infection. We have to be very careful about the long-term effects of what we're bringing into our environments. In some instances, we need to have those barriers, but in some cases, what is the best approach? And we don't want to create waste, which equals cost and wasted time, that's going to provide a hindrance to collaboration and productivity down the way. So obviously from infection prevention, that's something that healthcare is being founded in. We had influence on ventilation, filtration, and touch-free operation. That's so true as we carry forward. But what we're starting to see, some additional things are things like mobile technology. Physicians have their own devices. They float from space to space to space, kind of reducing that cross-contamination because, they're using it. We can apply that to our workplaces in some degrees as we start to explore hybrid workspaces. Not having a dedicated desk or hardware. You bring your own, these high-touch, surfaces and things. You bring them, and what that does is it allows for choice. It allows you to work anywhere. So desk-mounted computers and screens may be a thing of the past. We're also seeing just healthcare has explosive amounts of data, right, that they're generating from their patient populations. But we're also seeing that in terms of buildings as they're becoming smarter. And they even now us as individuals, as we start to look at, patient tracking, people tracking, usage of spaces. So we're going to start to see that shift very soon on how that information starts to inform our buildings. And then also, the stringent cleaning and maintenance plans. Hospitals have had those in place. Very clear about how to use disinfectants and antibacterials. But when it's translating to other markets and sectors, such as higher education and the workplace, I know Linda will absolutely agree with me that it's imperative that you understand what you're bringing into your facilities, that you're testing, learning, and and properly using them, because they will break down surfaces within months if they're not used correctly. So that's going to create risk to patients and individuals as well as cost in the end. And then lastly, I want to talk a little bit about it's essential, workplace is all about people and outcomes. So just as providers for years, have really looked at kind of like the social determinants of health, like what's going to prevent somebody from leading a healthy lifestyle. And that ranges everything from cognitive abilities to social support at home to transportation to and from. I think employers need to embrace that too. They need to really be considering, that level of diversity, really looking at how effectively, plan for teams and their individual needs so that they can really bring them together. So we're really seeing this great emergence of a hybrid design as the office. It's not going to go away, but it's going to be something that balances all aspects. And it's such a great time. I'm looking at despite all that we're going through, it's a great time for our industries to really begin to catch up and really offer the best ways and new ways of working.
Absolutely, Roseanne. Linda, did you want to come in?
I did. I don't know if this is a good lesson learned, I think, from the hospital side about cybersecurity. When you move all these laptops to people's personal Wi-Fi, the vulnerability from a cybersecurity standpoint is really high. And so we've had really to lock down in the last week or two and put out all sorts of new firewalls and barriers. Like we can't access Gmail, any social media through our work provided equipment. So as an example, to prevent any cyber security attacks. So, and that's huge because, that could be detrimental to a patient's health. They're holding hospitals ransom for all the patient information. They freeze their IHIS or their electronic medical records information. I mean, it's a real danger right now. So that's a lesson that can be kind of forward to any business, any firm, because you've now set up a huge net of vulnerability for access to your infrastructure. So it slowed our work down.
Yeah, I mean, I think.
Yeah, go ahead.
Yeah, no, I think it's just interesting that just safety as a central theme has become so important to us in so many different ways. So, on the one hand, if you look at, cybersecurity, just allowing for flexibility for employees in any workplace is going to open up, organizations to threats that maybe they've not faced before. That may not be the kind of virus that infects your respiratory system. It might be the virus that infects your hard drive. And so it's just a different form of safety. And yet, I think in all things, I really love what Roseanne said, that a form cannot follow infection. Space cannot be designed just around infection, and healthcare spaces know that, right? Spaces still have to feel humane to patients, just as and so that's something that we have to all, I think, understand as well. So while we're recognizing new threats, as you brought up, Linda, I think we also have to understand that we can't have those threats stand in the way of providing a really humane and supportive workplace experience. Just one last thing before we go into audience Q&A, I just want to emphasize another thing that Roseanne said right at the end about employers understanding now the determinants of health for their workforce. The interior design community with the well-building movement, with the healthy buildings movement in general, has really been pushing for that, saying that buildings have an effect on people's health. And I think as organizations, now we're all starting to understand that in a really visceral way. It's just a new role for employers, and that is something healthcare organizations also have experience in that maybe other organizations don't. So I think there's a lot to learn here and a lot of little lessons to draw out and little perspectives to draw out. So go ahead.
Sorry. I just was thinking about what you were saying about risk and managing risk, and Roseanne's comment. One thing that I have thought was interesting through all of this was that in terms of reacting to what was happening with design decisions or stuff like that, I have found that we really have steered away from knee-jerk reactions and really have been thoughtful about what are the investments that make sense to make and what are things that really are best to deal with from a behavioral standpoint. Just by changing our behavior, we can create the social distances that keep us safe. We don't need to start putting walls everywhere, which, at the beginning of this, we've seen some articles come out with literally fortresses, and things like that. And that really scared me, frankly, because that's just pendulum swing to,
too far
off. So,
right.
I think that that's another thing that might be counterintuitive, that, some industries not in healthcare might think they need to do a ton of things and start putting all those walls everywhere, when frankly, in healthcare environments where there is much knowledge about it, I think we're being absolutely safe, but not going overboard with the investments that are, actually not effective or science driven.
Right, exactly. I don't want to exhaust all our ideas now. When you say science driven, it reminds me that there's also something to talk about what Roseanne said, about evidence-based design versus this quick iterative process that we've all become comfortable with. And again, that's another balance that healthcare organizations have been, usually good at striking. But we'll come to that in a few seconds. We have a few questions in from our audience today. Before I go to those, I just want to thank our sponsors for today's discussion: Ava, DuPont, Tedlar, etc. National, Material Bank, Loftball, and Versteel for making today's discussion possible. Also, of course, thank you to Linda from Wexner Medical Center, Jennifer from Memorial Sloan Kettering, and Roseanne from EYP for all your insights already so far. It's been already a fascinating discussion. Our first question is from Carol Shepard, and she says, how do you see telemedicine impacting your use and design of space moving forward? Telemedicine has come up a couple of times in your comments, so I'd love to hear a little bit more about that. How is that in particular going to change healthcare spaces?
I think it's I'll just share my thoughts, and I'm sure everyone here has thoughts about it. There's like the macro view of like, what does it mean in terms of even locations, right? Of like real estate strategies altogether, a more distributed model of healthcare is possible. Already, in the past, we have seen more and more demand in our regional network for ourselves, with patients wanting proximity care more and more. So I think, that's at the macro level, but it goes all the way to the micro of like, how do you design a room acoustically in an ideal way to support, the conversations that take place. So that's all I have for right now, but, just thinking that it has effects all across the board. And also, actually, I think probably the most difficult part for me, at least right now, it feels to unpack is how it will affect workflows and how it may affect job roles and where the boundaries of those roles are. That I think, is like going to be a real process that unfolds over time.
Mm-hmm. Yeah, we have, if I can jump in, we had standards and paradigms for changing our faculty offices because we do have a lot of research and translational medicine, between faculties teaching and also providing care, and we're moving them from their 120 square foot office to an 80 square foot office, and giving them choices of different setups. And we've had to flip everything to support telemedicine for the faculty, and and so shared officing, which was kind of an idea we were trying to work around with, is not feasible when you're doing telemedicine. So we're kind of back to private office for faculty instead of shared, or having shared, but it's in different times. So you might share an office, but you're not there together because of the telemedicine aspect of offstage communication with patients. And then our exam rooms, we've already integrated in telemedicine, but how do you get the support staff, the nurses, PCAs, all in sync with, okay, this one's going to be a televisit and it's not an in-person visit. So how do you sequence that and get all of that? Because the nurses have to do all the telemedicine stuff as well. So you're right. I mean, it's training and reprocess flow mapping, how we provide care in the ambulatory setting. Inpatient is not so different, I would agree, except for where the extended teammates are. The social workers, nutritionists, they can all work in a remote hoteling kind of conference room and off stage more. But, that's been a big impact to thinking differently about what faculty gets as benefits and what they need now versus, their 120 square foot traditional office with the big chair and the sofa and all that stuff. It's just different now. So I'm pretty excited because it's more functionally driven than status, and I get a wood desk. So it is, if you think about it,
Yeah. And that's the thing, I think, as this way of working, as you said, as those workflows settle, Certainly, we're going to start to see spatial dynamics change as well. But I'm going to let Roseanne come in because she did talk about physicians walking around with mobile devices. Roseanne?
Yeah, I did have a little more insight into the telehealth. You know, another impact that we're seeing is that, you know, it's virtual. It's great for smaller, diagnosis and things. But what we're starting to see impact is that we're losing the cues, the visual cues. We're losing, kind of getting to the depth of some of the diagnoses, but also, whenever you're in an exam office, the physician can walk in, he can do his role, he can walk out. And now we're starting to see that those exam times are going longer, which is causing a little bit of, a little bit of crunch in the flow. So that it is having implications. And I guess for the physical environment, the way we're addressing that is that you do need extremely better lighting and acoustics. And it's just something, again, it's that great experiment of really working through and how do we get to the best way we can interface virtually.
One thing I want to add, I think a couple of things that I wanted to mention. One is with telehealth, we are seeing, fatigue, increased fatigue from physicians, just the cadence, the fact that you're on a device or, all the time. So I think that as we think of telehealth becoming more and more part of the fabric, recharge moment, low-tech moments, opportunities for that might also become more and more important. And then the other thing is technology, obviously, the idea that for a patient, in some ways now with a device, they can have access to their entire care team of individuals, in one non-physical place, but that gives them access to those people in a way more easily. So there are many opportunities that are very exciting, but in the same way that technology brings opportunity, it really needs to be balanced. So these moments of, I think, recharge for physicians will be really important. And also, Roseanne was talking about cues that you have in person. Technology is still very much focused on function. And I think the next frontier will be really when technology, even for collaboration, beyond just telehealth, really providing better emotional connection between people and that cognitive experience that the in-person has. That's kind of the next frontier for technology, I think, in general, and it will be in particular important in telehealth, for example, where that kind of connection is really important.
I love that. I think just when we draw this one thread of telehealth, it just has so many implications, from, as Linda said, like what infrastructure and what facilities each person needs, to, as Roseanne was saying, like what we might be losing in the medical process as a result, what all of you have been saying in terms of workflows changing and the implications on workflows. And Jennifer, of course, your last point about, taking care of the people who, are using technology day in and day out and providing them some, low tech or no tech time. It's just, there's just so many implications to this. I mean, it seems like such a rich time to be a planner, a designer in the healthcare space. It's really fantastic. Dana Siegel has a quick follow-up question, I think, related to what we've been talking about. She says, besides patient-facing workers, what are some of the determining factors about which workplace functions and types of staff need to be on-site versus working from home? So, are there new determinations about, who needs to be on-site versus not, now that we have telehealth and we have other forms of, other ways of working from home as well. All of you touched on this a little bit, in your opening comments, but I'd love to just hear if you have any additional thoughts on that.
So I can go, the way that we're thinking about it for the longer term, there's kind of like this period now where, at least for the people who had functions where they don't interact with patient directly, so more corporate functions, for example, the default has been remote. but we're slowly, kind of reactivating, and some of the criteria that have expanded the kind of number of people who might come on site include things like agile teams that may need really, to be together to collaborate more effectively. So, and that doesn't mean they have to be on site all the time, but that may mean that there are moments where those teams need to be together on site. Also, people who are new to the organization. So
Onboarding.
Exactly, those moments are also important. In general, the approach we're taking is one that's more holistic, where we're looking at personas and really thinking about the type of work that's being done, so that we have this approach that is across the organization and less driven by maybe cultural preference of a manager or a leader, so that, there's more sense of equality, I think. And then there will be, very unique circumstances personal circumstances that we'll have to take into account. And I think those, we're still figuring this out, but we may deal with those more as exceptions. But, they are people who are at home, don't have the environment that's conducive to work. So we want to also empower those people to be able to come and find a place to work in their office. In general, I would say that the thinking is that presence on site is primarily driven by activities that are best done in person. So they tend to be the ones that are about connecting with others, whether it's a patient or a colleague. That's the main idea here.
I think we're very consistent as well with that. And we are mapping out task and workflow for onboarding, because a lot of times this onboarding is going to be virtual. So where the mentoring is always a huge part of the healthcare environment. How can we do things that are kind of standardized, and think about how it's easy to maybe move somebody in a support role from one department to another as well. So we're looking at flexibility of staff where we have surges for that as well. But our facilities, it's tough right now. 40% of our 7.7 million square feet of the medical center on campus is non-clinical, and 80% of it's vacant. So that's a whole real estate challenge. And how do we make, and so we own most of that, honestly. We release a lot of our clinic spaces, but we own quite a bit of our kind of anchor old admin buildings, and they're out of date. So we have to look at, are we going to repurpose those? Do we want to bring people back here when it would take a lot to make the air safe right now? So we're better off right now keeping as many people working remotely as possible, just because of that. So we don't have to spend that money to replace the HVAC system. We don't have to spend that money to relay out workspace. We can schedule in, swing shifts as needed. So I think it is kind of pausing and not overreacting. I think that's, Jennifer, I think we're aligned in the same thinking, because we, all our money has to go to patient care as much as possible, right? And PPE. So,
right. Sorry, go ahead, Jennifer, and then I have a follow up on that.
Just what Linda was saying, it really is about like leveraging those new capabilities around remote work, telehealth, and understand how we can leverage those to, also think about optimizing our resources so that we can focus on the mission. But as we optimize, it's also about repurposing the leftover space so that it really support those key activities that are best done in person.
Mm-hmm.
Right.
Yeah, we're turning a call center into a vaccine center right now. I mean, I'm serious. It's an offsite call center. Awesome. So we're turning it into a vaccine center, and we got to do it in like 2 weeks, 2-3 weeks. And it's insane, so again, that like huddle and run, mentality we have now, it's energizing, but it's fatiguing too. I mean, we have reactionary fatigue right now. And I think that's just as challenging to de-stress people as much as the COVID fatigue of wearing a mask. So respite spaces, administration has seen the light on providing respite for not only caregivers, but the support staff. You know, EVS needs a respite. You know, everybody that is supporting the enterprise needs some kind of respite. So we have an online wellness program that anybody can tap into for yoga or psychosocial support. You know, it's just amazing because we can't do it in person, but the investment of hiring people to help with mindfulness and, you know, try to help where we don't have the physical space to provide. So anyways, I just wanted to throw that out.
No, that's absolutely fantastic because it leads right into the next question I had lined up.
Oh.
You know, Dana Siegel also, again, Dana, thanks for the excellent questions, by the way, says, you know, what are some of the attributes of physical space that could hinder or support empathy? And I think that's a great next question, because when I hear Jennifer and Linda talking, all they're talking about is, you know, face-to-face connections, the needs of people who, you know, are, you know, burnt out or, you know, in difficult emotional situations. I mean, all of those things center around empathy. So, Linda, you spoke about respite spaces, which of course is really important. You spoke about wellness programs. You know, I'd love to hear from all three of you, just what are some spaces that we've found maybe make us a little less empathetic at this time? And what are some spaces that maybe we need to be thinking about to strengthen our empathy, to you know, allow us to act on our empathy with our coworkers and our employees?
Sorry, I'm going ahead. You know, the one thing that's coming to my mind immediately when you ask that question is the idea of neurodifferences and neurodiversity. And that is a topic that, you know, is coming up more and more, which is great. And, you know, I think the kind of like most basic way that I can think about it is non-diverse physical landscapes in offices really do not support neurodiversity, for example, do not support empathy either. You know, the kind of like, as humans, we are wired to want to see like variation. We as individuals have different reactions to stimulation, you know, whether visual, sound. And so providing diverse environments where different people can find a place where they can feel good is, you know, one way that I can immediately, you know, comes to mind when I think of empathy in design.
And I'm really, you know, we're a proponent of, you know, caring for the caregivers because they are interacting with so many people. And we already talked about how healthcare is one of the largest employers. You know, the importance of making sure that your employees feel valued and appreciated is, you know, an incredibly, you know, strategic way of, you know, just, you know, raising, you know, hopes and compassion. So we need to make sure that our staff do have those breakout spaces. And I know through the pandemic, that has been the number one challenge is that staff can't go to those staff rooms. They already are at capacity. So watching some of these institutions, they are transferring, they're finding these spaces wherever they can, where, you know, a lot of spaces have been taken over by PPE storage and other, you know, more, you know, patient or clinical aspects. But finding these areas along sky bridges, setting up tables and chairs. I know that staff are going out to their cars because that's the only place that they feel safe to have, you know, lunch, to actually take off their mask and eat. So I think just really bringing, you know, empathy into the space. You know, how do we find those ways to really share and just visibly exhibit that we appreciate you? You know, and that's something you see the public art that's going on outside. You know, the people are really coming together and you know, doing these amazing things. But can we bring that to the interiors too, so that it's something more permanent that people are reminded of? And number one, just giving them spaces that they can enjoy and relax, that are their own.
Yeah, it was really easy to do that in the summer because we could put up tents and people would get outside and enjoy things, or even set up, you know, put more tables over overhangs. And now that we're, you know, we're Ohio. It's getting colder, right? Though we just had a great week last week in the 70s. But it's tougher when you're indoors. And so a lot of the staff went outside to eat. And so we're finding that to give the staff the connection space or the individual space, we're turning auditoriums and conference rooms into clusters or bubbles so that we're not creating hot spots. I think that's a fear, because when you eat, you take your mask off, right? Mm-hmm. So we have to make sure that those kind of eating times and break times are safe. But we're also looking at we've had our staff had asked for individual immersion spaces where you can close the door, you can put on a view of the beach or the trees or whatever, and have a sound immersion, and you're in a massage recliner. And, you know, it's 20 minutes of just respite, because they don't get a whole lot. If you think about it, we have a lot of staff get COVID, and then you're quarantining everybody that's in contact with them. That takes away almost an entire unit of staff. So how do you create a place that can de-stress that staff person so they can restore themselves and then get back to work very quickly, because everyone's stretched so thin. It is a tight wire right now. You're absolutely right. And we're trying to find every nook and cranny we can without taking away a patient room, which, you know, is with this escalation of COVID cases, it's even more challenging. So finding joy, I think that's the biggest word we've heard from our staff is, where can I go to find a moment of joy? So, and it's tough. Our lobbies are full of queue lines for temperature checks, where we used to have performances in our lobby of singers and dance and wonderful music and piano players, and that's all gone. It's stopped, right? So I think, you know, that's my next challenge is with the winter months. What do we do to bring, you know, joy of the holidays in, and decorations? We're not putting decorations up much, right? Because you have to clean them and disinfect them. So, and there's no room for them, right? Because of all the queuing lines. So it is a challenge to bring, you know, so we're looking for our next challenge is the joyfulness. And I'm sure everybody's feeling that, you know, your holiday party, what are you going to do in corporate life or in, you know, that's our next kind of challenge for us in the design world, I think.
I love that. We've gone from technology to empathy to joy. And I really, you know, I wish we could make joy a standard for at least some spaces, you know, for interior design, just in general, right? Even once we're out of this, the vaccine is here, we're all okay, right? We still need places for joy. And I think it's such an important metric. We talk a lot about satisfaction and productivity and, you know, a break or like, you know, a respite, but we don't really talk about joy. That's such an interesting idea. Rosanna smiling broadly. You know, I just love that. I had to say that. We have a question from Henry Chow here, but Roseanne, before we do that, do you have a reaction to that? To, you know, spaces that build empathy and what Linda just said?
I think that's a wonderful concept. I mean, you know, joy, to think of that as an aspect, as a component to a space. I mean, we do our best to design for all the senses. You know, you really want, you know, to engage everyone at all levels of, you know, human abilities, you know, and the way to do that is through all the senses. But whenever you start to think about it and put it in that context of joy, that's a beautiful way of looking at it. And I definitely want to carry that forward.
Yeah, absolutely. We have a question from Henry Chow who says, you know, beyond the, you know, workplace safety measures and COVID-19 measures, now that we understand a little bit more, or we are become more face-to-face with the social determinants of health, you know, understanding that maybe, you know, people of color in our workplace or people who come from different socioeconomic backgrounds, or more importantly, also, as Jennifer said, you know, people who are neurodiverse may have very different needs in the workplace. You know, has some of that thinking come into your work, you know, more of late recently? Just a quick plug, I just want to say, just last week, our think tank discussion was about designing for neurodiversity. And the recording of that will be on our website next week. So if you just go to metropolismag.com/think tank, even if you didn't get to that discussion, you'll be able to at least pick up some of it there. So I just look out for that. But just getting back to that idea, now that we're recognizing that different parts of our workplace may be at risk in different ways or have different challenges, how is that affecting how we think about workplace design? Rosanna, I wonder if you want to take that first, and then we'll hear from Jennifer and Linda.
Yeah, I think, where we go from here, there's so many different ways of looking at human abilities. We all, work different. We all are at different cognitive levels. We have different needs. And as we begin to really, explore spaces, having those moments of breakouts, having those, where we have the intent, some of stressors cause more stress to others, noise, and generate breakout spaces. And like you mentioned, having those relaxation. We're starting to see more technology, and how do we really immerse ourselves to really reach those, those lower relaxation levels, so that we can re-energize and then get back out there and be at our productive best. So looking at really bringing those into the workplaces, and experience them. One thing in response to your joy factors, I was thinking through is we do quite a bit of experiential design. I think that's where I'd love to see more of that really, when you walk through a space, it's a visceral experience that really, brings, takes you out of the stress of where you are now. We've been doing that for years for patient, the patient experience, right? And families, we take them, but I mean, it's for everybody. It's for everyone who enters that building, to really take them out of the moment and whatever those stresses are that are applying to them today.
Linda, Jennifer, any responses to our new understanding around, determinants of health that might be outside of the workplace itself, but that have an effect on how people work?
I think so. Oh, go ahead.
Go ahead, Linda. I don't really go.
Okay. Well, we've had a real focus on understanding people's home workplace, and not everybody's home is like ours. Everybody has we have such a diverse workplace and population that we actually, our help has our CEO of our hospital has, our chancellor has really done a diversity 21-day challenge that we all need to embrace and understand the diversity and the needs of our community and our family. And so we have a lot of listening sessions, but also to understand what people need. We're learning as we're helping them design their home work environment that they may not have a setup like I have. I'm blessed to have a work table and a monitor stand. I have an ergonomic chair that I was actually able to bring from work, but somebody might be working at their kitchen table. So how are we going to support them to get there a better workplace that's safe, that doesn't create workplace stress, that they can be away from their family members? How do we support them if they don't have Wi-Fi? There's just a whole variety that we may not have understood that was in our common box, if you will, that we live in. So, our challenge has been from Dr. Paz, how do we embrace everybody's differences and enable them to be their best? And that ours is the workplace design. So whether it's in their home or able to help their kids, it's just a different way of looking at it. And if they're nutritionally challenged, we're looking at that too. We're supporting our family and more in the nutritional side as well, and how do we support them? So the diversity aspect of support is something we really didn't touch on until the pandemic opened our eyes to what our whole workplace needs are beyond just coming to work. It was really humbling. So I don't know if that's answering your question, Avi, but it's just made us much more sensitive, and our leadership's driving it. It's just amazing. So
we have a couple of questions now lined up that are sort of more nuts and bolts shall we
Okay.
say? But we'll get to those in just a minute. Before we do that, we're here talking about a safe new normal and how healthcare workplaces might be leading the way. And we have with us Linda Gable from the Wexner Medical Center. We have with us Jennifer Manier from Memorial Sloan Kettering and Roseanne Pisklak from EYP. Thank you all so much for all your insights so far. It's been absolutely fantastic. And thank you to all our audience members who've been submitting questions. They've been really great. We have a question from Chip Young who's asking about interior materials and finishes, furnishings. As we've gone through this experience in healthcare spaces, have you found that they have generally borne up to the challenge of this new era, or have there been hotspots where you're considering changes or improvements or updates? What has done well maybe, and what maybe we need more options on?
I think flooring has been a challenge for a lot of places. The hand sanitizing stations, the product tends to fall on the floor, deteriorates the floor. So I think, I'm not into the day-to-day design of our spaces, but certainly I know that is an area that we're looking into and finding the right balance, because obviously hard surfaces might be easier to clean, but from an acoustics perspective, they can be challenging. So it's finding the right balance between those considerations.
Yeah, we've had ongoing problems just with our routine cleaning in our acute care of polyurethane or water-based finishes, coated fabrics, wood finishes, polyurethane arm caps. Such a I would say catastrophic failure over the last 5 years. So we've made changes in our acute care to adapt to that, but we never applied that to our ambulatory care as much, or our office space. So office, we're not seeing as much because no one's there really. We're not cleaning 20 times a day. But ambulatory, we're taking those and disinfecting wipes, and no fabric or furniture finish is rated to take anything but a sanitary or sanitization chemical. And so we're using disinfecting chemicals, bleach-based hydrogen peroxide, and others on surfaces 10 to 20 times a day that never saw that before and was never selected for that type of chemical resistance. So we're starting to see failures in our ambulatory care as those clinics have come back. Now we have half the furniture, so only half of it's getting damaged, and so we have the other half in storage. So we've got a Band-Aid where we can kind of flip those out, but we're seeing more accelerated damage and fabrics and finishes in the more ambulatory hospitality aesthetic than we do in our acute care, because we already tackled it. We already started tackling it about 3 or 4 years ago. So it is challenging for sure, but we're finding that the polyurethane-based finishes, even flooring that has a polyurethane top coat, are being destroyed by the hand sanitizers. You're absolutely right. So we're kind of on a hyper awareness, and we have to budget for replacement. So that hits the financial. But so yeah, we are testing and modifying our tests on what fabrics and finishes we use, and it's more rigorous than the industry standards right now. So I'm part of the Durable Coated Fabric Task Force group through AHID, and we have finally convinced the Coated Fabric Fabricators of America, CFFA. They create the standards for coated fabrics to create a healthcare standard. So now we have something out there that we can send to the fabric manufacturers to say, you need to meet this in order to have the expectation of durability in the healthcare environment. And it's brand new, came out in August. So we're getting there, but COVID has just accelerated the failures and will continue when we come back to work. And the behavior is to still disinfect the non-clinical workspaces. So that's what we're anticipating, we're predicting. that we are going to see more and more failures, and that we have to budget for, unfortunately. But it's a big lesson learned for sure.
And the piggyback, I mean, it really is, with the CDC's recommendation to remove textiles out of patient areas, we're already starting to see those cubicle curtains come down. I mean, that happened in the beginning. Flooring, carpeting, where, we were trying to soften our spaces. Some of the flooring's coming out. Upholstery as well is going to have to be either changed or replaced. So I think we need to start looking at that much differently and start thinking about maybe maintenance, programs, or like, for example, we replace lighting, we re-lamp, to change it out every so often so that we're doing it on a global basis. We've budgeted for it. We can address it at the same time. I think we need to start looking at furniture and surfaces in that same manner if we continue to do the harsh cleaning and protocols that we've been following recently. I think it's just something that we have to be budgeting for it and planning.
And component-based furniture, and so that we can replace the failure point pieces. And we're trying to avoid wood as much as we can. So it's just too porous of a material. So it is a challenge. And the life cycle cost, we have to go from 7 years ROI for furniture. We're down to 3 to 5 years. You're absolutely right.
Oh my God.
Absolutely right. And it's a hard sell to capital money. It's like, what are you going to buy? A C-arm? Or are you going to buy new furniture for this waiting area or patient room? So
it really is a big shift in healthcare design, where we design for longevity. We're going to have to start thinking, shorter term. That's going to have big consequences.
Wow. We're going to come back to this in just a second, because I think there's a link question here. So let's hold these two ideas in mind, both on disinfection and cleaning protocols, as well as on life cycle durability and so on. But before we come back to that, sorry, I'm going to insert a question here. Doug Whitnable says, Jennifer, you started us off talking about how healthcare spaces are a little bit more traditional. There may be, more cubicles and so on. We've had a move in general across other kinds of workplaces to certainly more, I don't want to use the word open plan, but certainly more focused on shared spaces rather than, cellular or cubicle type spaces. And, this open plan or not discussion, I don't know if we want to get into that, but Doug says, is there some kind of thinking that dividing up space into smaller areas might be better for cleaning, for air quality control and things like that? Are you seeing any kind of like inclination, let's say one way or the other, all three of you, just on space layouts, as you, Linda, think of, upgrading those workplaces and converting them, whatever workplace you do retain, do you have any thoughts already forming around that? And Roseanne, across your clients, how are you thinking about that?
We're really looking, as we look at future workspaces, in rethinking some of those, because healthcare has been on a trajectory of consolidation for some time. So they're kind of rethinking the workspaces already, and there was complications on how do you condense and get people, the number of people you need in a space. So this work from home is working where we can start to do some shifts, start thinking in terms of shifts, and really flexing the space in terms of role is in terms of shifts in time, and then also the resource groups as well. So we're starting to see that. Now with that comes, each of these resource groups might work a little differently. So we really have to examine how those spaces and the culture of each individual before we can really address how we can do furniture layouts. But essentially what we are seeing is that we have to provide some sort of incentive to draw people back to the office. And so we want to provide spaces that are going to make them feel comfortable. They do have those opportunities to have smaller gatherings, smaller groupings of maybe a cohabit group of individuals, or whether it be desk surfaces that don't have actual, no one's tethered to them. So we're going to see, I think, variation of spaces so that people can distance when they need to, they can work differently. And as we mentioned throughout this conversation, is that this has been key, that we've really had this heightened awareness of how people work and what's working for them. And so we really need to design those flexible spaces to make sure that we accommodate everyone to the best that we can.
Yeah, I think, it is about providing that diversity of space types. I think, the open office debate is a bit, focused on like environments that are, totally out of fashion anyway today, where it's not just open, it is absolutely a balance of providing spaces for focus and for collaboration. And yes, focus tends to be best done in environments that have some degree of enclosure, but there are many ways to solve for that, not necessarily with built walls. I also just want to say that the idea of compressing space has its limits, right? There is so much that you can do in terms of increasing density. And this juncture in time, where this big pilot that we went through of remote work has proven that it can be successful, at least for a portion of the people. And so that gives opportunity to then really leverage the space that we maintain to support more collaboration, without a doubt. I mean, in our environment, I don't know how it was for you, Linda, but in our environment already before all of this happened, I would say we had a deficit in collaboration space.
Yes, absolutely.
So, we're absolutely focused on increasing that, not only because we needed it before, but also because in this new model, when people come on site, it is going to be a lot of the time to interact with others. Because doing focused work, if you have the right environment at home, is easy to do at home, right? Collaborating with others at home, that's a little harder. So if we're going to invest in space, I think it's going to be heavily focused on that. But it can't be only that. And of course, you have those phone calls. There will be distributed teams too. So I may need to collaborate with people who are with me on site, but half of our team might be remote. So we're still going to need those enclosed environments, right, to support different ways of collaborating in person and with blended.
Linda, a very quick question for you from one of our attendees. Are you specifically considering any air purification technologies in particular? Are there things, as you're looking at upgrades or changes to the spaces, both clinical and non-clinical?
Well, for clinical, we have to be careful because we have to do no harm. So some of the technologies that are kind of out there right now, like the light disinfecting or light purifying, can have some damaging effects to skin and people. So we have to be wary of that. But there are some technologies that cleanse the ductwork. And of course, we use HEPA filtration quite a bit. We're looking at adding more areas to do the HEPA filtration and more air exchanges. So that's pretty easy. For ozone type, that's not really going to help the virus. What you need is MERS 13 filters and more volumes of air exchange. So some of these old buildings, it'll shut down the HVAC system because they're not geared to handle that type of filter. So, we're getting into the whole facility engineering thing. So we're assessing every building. What building can we, improve upon, and what do we just kind of not backfill and maybe do more hoteling in a newer building that we can do those enhancements to. So we have to make some hard choices, but yeah, definitely collaboration. And, we're kind of chuckling to ourselves. We had in our James Cancer Tower every single team room had video conferencing, and we just took it all out because they said they didn't need it anymore, like in January. So now they want it all back again. And it's, fortunately the infrastructure is still there, but, but to get the video cameras back and all that, but I think flexibility in that technology is definitely there. But anyways, but I think that air purifying, I think the hydrogen peroxide sprays with the mechanical systems, we are considering that, but we're a little worried about the 24/7 UVC light use, or the severe end of the ultraviolet light, just because we don't know what it's going to do to the patients. So we'll do when they're not in the room, but we're not going to use it, I think, when it's an occupied space. So.
Again,
it's a great question.
Yeah, it's some things you can't be iterative about. It has to be evidence-based, and you kind of have to feel your way through it and look at results.
Yeah.
So the question that one question that I held in reserve, one of our attendees, ED, says, all of the stuff that we're talking about, of course, it has an environmental impact, right? So if we're talking about, more cleaning protocols and furniture not standing up to that, and of course, COVID-19 hopefully is not going to be a permanent condition, and this might be a particularly resource-intensive time. And yet, healthcare spaces, I know that, folks who do interior design and facilities in healthcare spaces and strategy for healthcare spaces, what you're fighting against all the time is that they're so resource heavy as it is. And so, adding these extra resources, I'm sure it's a challenge in many ways, but it's also a challenge from the point of view of environmental impact. So how are you thinking about that long term? Roseanne, maybe you want to comment on that first, and then we'll have Jennifer and Linda. Just generally, how are you thinking about, environmental, which I'm sure clients are concerned about. It's just, they're in a hard place right now.
Absolutely. Healthcare has been in a hard place, because that is one of the challenges that we, designing for longevity against these harsh chemicals that we've had in our institutions for some time has been of great concern. So finding, it really comes down, we can bring in sustainable products, and we do look at those, but we have to test them. They have to be tried and true, and they have to be able to perform. And that's why I strongly urge that everyone is getting the data on the materials and looking at those cleaners. There are some EPA approved cleaners out there that work as well. I'm not sure every institution does have their preferred chemicals that they use, and I think that's just where we really need to be very careful. But we have to be on. It has to perform. We're talking flooring. Flooring is the largest surface, in a building, largest contiguous surface in a building. So we have to make sure that we're looking at the right product for the right space. So whether it be, patient areas, looking for things like, rubber flooring or linoleum that do have some inherent properties in them. But again, we have to look at long-term and what the facility itself is able to maintain on a regular basis.
Right. Again, another tough balancing act, right?
Mm-hmm. Yeah, it definitely is challenging. A lot of, just like what Linda was saying earlier, a lot of the leases, that we have tend to be much longer than corporate companies own space. So we have a lot of legacy space that's not always, that was not always designed with those concerns in mind initially. Certainly, as we're moving forward and thinking about new investments, absolutely, that's part of our thinking. I would say the kind of thing that we can do, certainly without further investment, is as we are looking at optimizing our spaces through leveraging these new opportunities to think about our work environment beyond the walls of our, physical facilities, it does give the opportunity to potentially reduce our footprint, which that would be a huge impact in and of itself, right? So that's one thing to consider.
Right.
Yeah, I think one thing that we've been doing, I think quite successfully the last 7 years, is getting rid of the old static wood desks and clunky furniture and going to a kit of parts program where we still have cost centers and departments like to own their stuff, but we can reconfigure and we have standards. And it may not perfectly fit wall to wall, but it's going to be a standard size that can be repurposed and used somewhere else. So the idea of flexibility and adaptability, and having freestanding furniture wrapped with panels so that we can reconfigure and the panels can go away or they can come back up in. And we see the biggest difference in where we've implemented the new furniture and where we have the old surface hung, 84-inch high panels systems that are just a pain, and you've just got to take everything down before you can reconfigure. And so we're trying to look for more flexible solutions to that when we invest and buy new. And our conference rooms have training tables, they're ganged together, so that we can rearrange, repurpose. And with COVID, now they're hoteling workstations. So I think that we're trying to think more about our furniture being nimble and flexible. And we're just going to have to recycle as much as we can and avoid the landfill, but try to recycle all those old panel systems that are 20, 30 years old and invest in some flexibility. So I think that's our biggest sea change that proved it. Like this past year, it's crazy. It took a while for people to get on board, to give up their wood desks. So
we can't be wasteful, frankly, in health.
Right.
We can't afford it. So we really, this idea of flexibility is absolutely key in not just, the buzzword sense of it, but really to be able to make the best use of our resources so we can focus them on the core of what we're trying to achieve.
Mm-hmm.
Right. Yeah. Really quickly, we have just a few minutes left of our time, but I just want to quickly summarize what you've said here, because I think all three of you have given us some really important points. And sustainability is so important today. We cannot lose sight of that, while we're responding to the challenges of today. The fact of the matter is that across all sectors, we've seen renovation cycles get shorter and shorter. So, while we're seeing now healthcare being in the space where, because of all of the challenges, things are wearing out faster, the point has been that in other sectors, people have been replacing things even when they haven't worn out. So, there are challenges across sectors and we can learn from healthcare. But I think the three of you gave some really great strategies. Roseanne, the idea of right sizing, right? So what is right for what environment? Are you over designing in certain places and are you under designing in certain places? And all of that has an impact on carbon footprint, has an impact on landfill, it has an impact on reuse. So I think that's really vital. Like, we have to be sure that what we're doing is exactly a right fit for the space. And then the second thing, of course, is building as much for reuse and recycling, and that's really important too. Right. And then the third thing is, Linda, you said this in response to an earlier question, is designed for disassembly. So, if you don't have to throw the entire system out, but can just change a couple of parts when they wear out, now that's a huge sustainable saving. So really, we need the manufacturing industry, in addition to, designing for resistance against chemicals and so on, also at the same time to be thinking about, flexible, demountable, disassemblable furnishings, and those two things can go together. So that's really important. We're almost at the end of our program here today. This has been an absolutely fantastic discussion. We've discussed so many things here. We started with the idea of empathy. We started with the idea of flexibility. We've circled through joy. Linda, I'm never going to forget that. Roseanne talking about healthcare organizations being uniquely empathetic. I think that's so vital. Sorry, Jennifer. And Roseanne, talking about, always keeping your eye on exactly the function that you're designing for, and not letting infection define space. All of those are just, they're vital principles, and I think they've resonated through all your responses. This is a very challenging time, and it's a challenging topic, and I want to thank all three of you for the work you do in keeping our healthcare communities and our healthcare providers, safe and healthy and happy during these very tough times. Thank you so much for what you do. I want to thank our sponsors, Ava, DuPont, etc. National, Material Bank, Loftwall, and Versteel for supporting today's discussion and making it possible. I also want to thank all our audience members for an extremely lively discussion. Thank you so much for the questions you've brought in. They've been absolutely fantastic. I know we're leaving some on the table. I apologize for that, but hopefully we've addressed some of the principles at least behind what you've asked in responses to other questions. I urge you to look out for a recording of today's discussion in a couple of weeks. It'll be up on metropolismag.com/thinktank. We're also going to be publishing a report of this discussion on our website, metropolismag.com, as well as in a print issue in early 2021. So please look out for that. One last big thank you to EYP, the team at EYP, for hosting today's discussion, as well as for bringing our wonderful panelists together. This has been stimulating, fascinating, and I think there's so much that we can all learn from the work that all of you are doing in the healthcare sector. It's absolutely fantastic. Thank you so much for your insights, and have a great evening.